Is on face masks. Taiwan has a bigger population than New York State. Early on, they had universal wearing of face masks.
No problem with face masks if the governors want to do that. You know, we ordered, I don't know if you know, 500 million face masks. We have hundreds of millions right now. And if people want to wear them, it's up to the governors. If the governors want that, it's up to them. Now, it's more appropriate in some states, obviously, than others. You have the big plains, and you have certain states where it's much less necessary. But no, that's up to the governors, and we have that very well covered, I think, face masks. But
people are wearing masks.
We have hundreds of millions of face masks, and we have at least 500 million. That's a lot. We'll have them very shortly.
Lots of people are wearing face masks now that the federal government advised it. It was almost overnight. But less than a month ago, our Surgeon General said that, and I'm quoting, they're, quote, not effective in preventing the general public from catching coronavirus. I mean, should there be accountability there and also for the HHS Secretary?
Well, I don't know. Would anybody like to speak about it? I think, just so you understand, if somebody wants to wear them, I'm all for it. Would somebody like to discuss that?
Go for it, boss.
I think the comments that we made when we came into face masks, and I think it's important when we came out with the CDC guidance about face masks, or what we called face coverings, was in recognition of the growing understanding of asymptomatic infection or pre-symptomatic infection, was the recognition that we could use a barrier. And the reason, you know, and I have mine when I'm in public, that right here, that I use, you know, that this barrier, in case I was in fact infected, if I didn't know, is a barrier to prevent me to protect you in case I'm and happen to be asymptomatically infected. There's very good data to show that the ability of viral particles to go through a barrier is substantially diminished. And that's why we recommended these face coverings. I think if you go back to when CDC came out with that recommendation, some people may think intuitively it's to protect them from getting infected. No, it was to protect you from potentially getting infected by me when I go out in public. Jerome, do you?
Sure.
I actually appreciate you asking that question because it's one that that we've had to clarify several times, and I understand why the American public has been confused over time. As Dr. Redfield mentioned, initially we said, based on CDC, World Health Organization, and most other major public health organizations, that the public needed to know that these masks were not effective or shown to be effective in preventing you, if you wear a mask, from catching coronavirus. Another important thing to remember is the context of those statements was a run on medical masks, on N95 masks, and our healthcare workers were at risk. What's changed? What's changed is we found out that unlike past viruses that are spread through the respiratory route, a significant proportion of coronavirus cases can be traced back to asymptomatic spread. So, the task force deliberated this. We've always told you that we will look at the facts and we will give people recommendations based on the best available evidence at the time. And once we saw that asymptomatic spread, we said, well, masks still aren't effective, and from our point of view at preventing you from catching coronavirus in a significant way. But we've always told people that they should wear masks if they know they have symptoms to prevent them from spreading to other people. Well, now that we know about 25 to 50% of people are spreading asymptomatically, we suggested people wear cloth facial coverings to prevent asymptomatic spread. You wear your mask to protect me,